There's a specific reason plantar fasciitis keeps coming back when you're doing everything you were told to do. And it's nothing to do with how consistent you've been. You stretch every morning before you get out of bed. You bought the right shoes. You've probably had at least one injection that worked for several weeks and then stopped. And every time the pain comes back, you go through the same cycle. After 25 years and more than 25,000 procedures as a foot and ankle surgeon, I can tell you exactly why that cycle keeps repeating. Plantar fasciitis doesn't stay the same problem over time. At some point, it changes into something completely different. And the moment that happens, every treatment you are doing becomes the wrong treatment. I'm going to show you exactly what that change is, how to know whether it's already happened in your foot, and what needs to happen next if it has happened. Why some standard advice works and then stops. Every piece of advice you've received about plantar fasciitis points in the same direction. Stretch your calf, wear supportive shoes, rest when it flares, use ice, take anti-inflammatories, maybe get a cortisone shot if it gets bad enough. That advice comes from your doctor, your physical therapist, every article online, and it's completely consistent across all of them. The protocol exists because it works. For patients who catch plantar fasciitis early, structured conservative care produces real results. Studies consistently show that 70 to 90% of cases resolve with this approach. The part almost nobody explains is that this protocol has a time window. It works because it's aimed at inflammation. Stretching increases blood flow to the inflamed tissue. Rest lets the inflammation calm down. Anti-inflammatories reduce the swelling. That's a completely sound treatment for an inflamed plantar fascia. The problem is after 3 to 6 months of ongoing symptoms, the tissue stops being inflamed and starts being something different. And the protocol aimed at inflammation does almost nothing for what that tissue has become. Your tissue changed, but the treatment approach never did. Once you understand what actually happens to the tissue after that window closes, the question stops being, why isn't my stretching working? And becomes, what does this tissue actually need right now? There is a specific biological shift that happens in the plantar fascia when the condition becomes chronic. And once I name it, everything about your last several months of treatment is going to click into place. That's what point 2 is about. Point 2, what actually happens to the tissue after the healing window closes. Most people think plantar fasciitis as one condition that just varies in severity. A mild case hurts a little. A severe case hurts a lot. The treatment is the same. You just apply more of it with a worse case. That's the mental model almost everyone is working from, and it's why so many people stay stuck. Plantar fasciitis is not one condition at different intensities. It's two completely different biological states that happen to produce the same symptoms, heel pain. In the early stage, the tissue is inflamed. That means your body is actively trying to fix it. Blood flow increases to the area, healing cells flood in, the tissue is angry, but it's working. In the chronic stage, something different has happened. The body gave up on the active repair process. The inflamed tissue dried out and scarred over. There's no longer a healing response running. The tissue is damaged and quiet. Scar tissue does not respond to stretching. You can stretch every morning for the rest of your life and scar tissue will not change. It doesn't have blood supply, cellular activity, or biological machinery to respond to that kind of load, which means the question you need answered right now is not how to stretch better, it's whether your tissue has already crossed into the chronic scarred stage, and if that has happened, what actually results and what restarts the healing process. In point 3, I'm going to give you a specific way to assess where your tissue is right now. 3 questions you can run against your own situation today before you ever see another practitioner, because the answer changes everything about what you do next. The diagnostic is next. It'll take about 2 minutes, and I will tell you more about your situation than any consultation. How to know which stage you're in. You're watching this because the standard approach hasn't stuck. The pain keeps returning. You're not sure whether to keep going or what you're doing, to try something new or finally go see someone. So let's figure it out together right now. Ask yourself these three things. Has your heel pain been present consistently for more than 3 to 6 months without a real break of 2 weeks or more where it genuinely felt better? Have you done at least 8 weeks of structured conservative care consisting of stretching, proper footwear, physical therapy, and seen little to no change that's lasting? Has your morning pain shifted from a sharp stab that eases quickly once you start moving to a deeper, duller ache that lingers for 30 minutes or more? Here's what answers tell you across the patients I've seen and stuck with this cycle. Two profiles show up consistently. The first is someone whose tissue is still active. The pain flares with use, settles with rest, and responds at least a little to a standard protocol, even if it comes back. The second is someone whose tissue has scarred. The pain is more consistent, less tied to a specific activity, almost always presents first thing in the morning with that deep, dull ache that takes a longer time to ease up and completely unresponsive to anything they've tried. 2 or 3 yes answers, and you are in the second profile. The tissue has already made the shift. And once you know that, the questions change completely. It stops being, how do I do this better? And becomes, what does this tissue actually need now? That's point 4. If you're finding these videos useful, please subscribe. Every week, I put out a video that explains foot and ankle conditions the way I explain them to my patients, in plain language with no runaround. Hit subscribe so you don't miss what comes next. Point 4, what the tissue actually needs at this stage. Here's what changes when you understand you're dealing with a chronic scar tissue and not active inflammation. The goal is no longer to reduce swelling or give the tissue time to heal. The goal is to restart a healing response that has completely shut down over time. That requires introducing something that tells the body there's an active injury here that needs repair. Because as far as your body is concerned, the tissue has stopped being an active repair site months ago. This matters right now because the longer the scar tissue sits without intervention, the more established it becomes. The treatments that work at this stage are fundamentally different from what works early. PRP, which is platelet-rich plasma, drawn from the patient's own blood and concentrated, delivers a flood of healing signals directly into the scarred fascia. Shockwave therapy sends target sound waves into the tissue to create microtrauma that forces the body to open a new healing response. Amniotic Wharton's jelly stem cell injections introduce growth factors that the tissue's own biology is no longer producing. These are not stronger versions of conservative care. They are a categorically different category of treatment built for the exact stage of that condition. People who come in and have done 6 months of failed conservative care and receive the right regenerative treatment move forward in ways they haven't in months. The one situation where even regenerative treatment has limits is when there is an underlying structural issue, a very flat foot, a significant biomechanical problem that is consistently restressing the fascia faster than any treatment can help. In that case, addressing the tissue alone without also correcting the mechanics produces temporary improvements that keep cycling back. The conversation belongs in the consultation with someone who can look at the whole picture. The last thing I can leave you with is one specific question to bring to your next appointment. It will tell you immediately whether the provider across from you understands what's actually happening in your tissue right now. What to do with this information tonight. Most appointments for chronic plantar fasciitis follow the same script. The patient describes the pain, the provider recommends more standard protocols or an injection. Nobody asks how long the tissue has been symptomatic or whether a biological state of the fascia has changed. The question I'm about to give you forces the conversation in one sentence. A provider who understands chronic plantar fasciitis will answer it immediately and specifically. A provider who doesn't will either redirect or give you a generic answer you've already heard. Think about a car battery that's completely dead. You can turn the key as many times as you want and nothing happens. Jumping it with cables restarts the electrical system from the outside. Once it's running again, the engine takes over. That's what regenerative treatment does for chronic plantar fascia tissue. The stretching is turning the key. At some point, you need to jump the cables first. The person who walks into their next appointment knowing which stage their tissue is in walks out with a plan that actually matches their biology. Everyone else walks out with a prescription for more of what hasn't worked. Before your next appointment, write down this. The question to ask, based on how long I've had this and how the tissue has responded so far, do you think I'm still in an active inflammatory stage, or has the tissue crossed into a chronic scarring? And is the treatment you're recommending designed for the specific stage? What a good answer sounds like. The provider directly addresses the tissue stage, confirms or challenges your self-assessment from a diagnostic in point 3, and either adjusts the treatment plan to match the current stage or explains specifically why continuing the current approach still makes sense for your situation. What an evasion sounds like. Let's give it a few more weeks. On its own, with no explanation of why waiting is biologically appropriate at this stage, the answer tells you the provider has not thought about the tissue state question at all. If the answer is an evasion, ask specifically whether regenerative options like PRP, shockwave therapy, or an amniotic injection has been considered for this case, and whether a referral to a foot and ankle specialist experienced in chronic plantar fasciitis is appropriate. If plantar fasciitis has been coming back for months, you are not failing at the protocol. The protocol stopped being the right tool at some point and nobody told you. You now know how to figure out whether that's happened, and you know what the right questions are to ask for your next appointment. That's a completely different position to be in than you were 20 minutes ago. The video linked below covers one misdiagnosis that keeps a specific group of plantar fasciitis patients stuck for years in the wrong treatment entirely. A nerve in the heel gets compressed and mimics a condition so closely that most providers never test for it. If you've done everything in this video and still aren't moving forward, watch the one next. The link is in the description and on the screen right now.